Newest diabetes patients' numbers is on the increase concerning health officials. According to Public Health Officer Griselda Mokoia, the hospital is concerned and the health department has campaigns that has always encouraged people to be aware of their lifestyles.
New situation at this point in time in regards to diabetes is that the total number of diabetic cases that we have has gone up from 2002 from 118 to 149 in 2006, because during that time we conducted a national diabetic campaign that was spearheaded by one of the diabetic doctors from New Zealand, from the Manukau District Health Board. And from that survey, the results that we found was our numbers has gone up from 118 to 149. And in 2008, our numbers again went up to 163. And this year alone, we have 10 new cases, which brings us to 173 cases. The department is very, very concerned by the fact that, we have a very small population, but our diabetic rates keep going up. We have done a lot of activities out in the community and other initiatives as well in the schools in regards to the promotion and prevention of diabetes, but I'm not too sure why the numbers are still going up and whether or not these initiatives have had an impact on the people.
Ms. Mokoia also said some of the contributing factors to diabetes is poor diet, lack of exercise, obesity, among other factors.
Contributing factors to diabetes is obesity. One of the major ones is obesity. And if we look at the population in general, a lot of our people are on the overweight side, and most of us are also obese. So I think one of the most important things for us now is to really look at encouraging our people to exercise. There are a lot of activities already in place in the communities. For example, Tuapa have their exercise program, Alofi North has their own, as well as the other villages. But I think for us now, our concern is to try and encourage the men folk to also take part, because a lot of the programs that are already happening is mostly for the women and the young people. So one of our concerns now is to find ways or activities that would also suit our men folk and encourage them to take part. It is our aim as a department to keep going, just paving the way for non-communicable diseases, because we have developed national plan of action for non-communicable diseases called the New Mbuialala Plan, and integrated NCD Plan 2009-13. So in this plan alone, there are specific activities targeting different groups of people and at different settings. So it's from the national level, at the policy and strategic level, whereby we'd hope to lobby for government support in regards to taxation of high sugar foods, and try and reduce the prices on fruits and vegetables. And from that level, we'll also go to the community as well as target the churches and the schools. The mentality that our people have in regards to diabetes is that they will continue to eat whatever they feel like eating, because the tablet's going to do the job. I think we have a challenge ahead of us to try and change that mentality and encourage our people to be much more responsible for their health, because the cost of medication is very expensive, and non-communicable diseases has cost our country a lot of money.
She also said the age group of diabetes patients now have changed from previous years of older people, now are seeing younger age group with the worrying disease. World Diabetes Day was last Sunday, the 14th of November.